my name is Juliana Rincon. I'm 23 years of age and I suffered a stroke due to an AVM. It happened on June the 8th. I was at home. It was a regular day. I was getting ready to go to work. When I woke up, I started feeling weakness on my left leg. As soon as I jumped in the shower, I started feeling weird, and the left side of my body started getting numb. I sat in the shower for about 15 minutes until my family member come and help me out. I was rushed to the Ventura hospital. I was there for about a week.
We spoke to the doctor there, and he explained us, like, not that detailed what my sister had. You know, he just told us that my sister suffered from bleeding in the brain, and it was caused by the AVM.
They told me that I suffered a stroke due to a brain malformation. That I was born with that, but I wasn't sure what was going on. They just told me that I had that in my head, and that's what caused the stroke, and the left side of my body was going to be without movement until I get rehab.
So I first met Juliana through her brother, Nicholas. Nicholas came into our office with his uncle. Juliana was still in rehab, recovering from her hemorrhage, and he had a couple films on a CD from her hospitalization, and he basically was asking for help. I wasn't there in the office at the time. He left his CD there for us, and when I came back at the end of the day, I reviewed his images on my computer, and I called him that evening on his cell phone.
I received a call from Dr. Peterson, and he told me, to tell you the truth, I felt really calm because it was like a friend, you know. It was like, oh, my name is Dr. Peterson, the doctor is going to help your sister. I specialize in AVMs and cardiovascular sickness, you know, and I was like, I felt really good, you know. Finally somebody came to me and actually was willing to help. You know, we didn't have insurance. You don't expect that this kind of things happen in your family. And well, seeing my sister in that condition, she couldn't like do a lot for herself because she was like in a bed, half of her body was paralyzed. She had like severe headaches due to the stroke, so it was a really scary time for us. It's like, as a family, you know, we all have jobs. We're not rich, you know. We just trying to look for the best help, and I think we were blessed to have like Dr. Peterson help us.
I told him that it looked like Juliana had a brain hemorrhage from an AVM, an arteriovenous malformation, which is a tangle of blood vessels that you're usually born with, and you often don't know that you have until it ruptures. I wanted to talk to him and Juliana and the rest of his family in my office, but I could tell that Nicholas was very nervous and very worried about his sister, understandably so. He loves her very much. So I spent a long time on the phone with him just in that initial conversation, just trying to give him a general overview of his sister's condition and where things would in general be headed. I told him that an AVM is a tangle of blood vessels that has burst open and that has a risk of rehemorrhaging again, and that it most likely needs to be treated. I mentioned that there'd be a couple different ways that we could treat it, and that right now her acute risk of having a brain bleed again from it was very low. So I thought for now she was safe, but that I wanted to meet with all of them together and discuss what I thought about her lesion and her AVM. A few weeks later, I saw her in my office. Her whole family was there. Her mom, her uncle, Nicholas. I showed them all the films. They had never seen them before. No one had ever shown them what her hemorrhage looked like, what her AVM looked like. I explained to them that unfortunately an AVM is something that once it hemorrhages can hemorrhage again, and it needs to be removed with surgery. There are some other options for treatment. You can zap it with radiation, which is sometimes a good option for lesions that are in a very difficult location to take out with surgery, high-risk location, and also good for lesions in people that are a little bit older, as the cure rate for those is much lower than with surgery. But for younger people who have an AVM in a place that is easy to remove with surgery, surgery is the best cure for this because there's no chance that it will come back. And for a young patient with many years to live like Juliana, you don't want to leave anything in her head or leave her with any chance of the thing coming back or not getting fixed. I told them that I recommended we do a cerebral angiogram. We place a small catheter through the leg artery and take pictures of all the blood vessels. This is something that's an awake procedure. It's very quick. It's often an outpatient procedure. You go home the same day. We performed the cerebral angiogram a few weeks later, which confirmed the arteriovenous malformation, the AVM that Juliana had, and showed me the architecture of the lesion and helped me make a recommendation for treatment. So what I thought was the safest treatment for her.
I was really scared of the angiogram because, you know, when they tell you that they're gonna stick something on your leg, I thought it was like a big tube, but it was like the size of an spaghetti. So I was like, okay, I didn't even felt it.
Based on its size and its location, as well as Juliana's age and her condition, I recommended that we try to cure it with surgery. I discussed that there's a small risk of worsening her neurologic condition with it, but that based on the location of the lesion, I could take it out with very minimal risk. And the benefit for that small risk is that she would be cured, and her risk of repeat hemorrhaging, seizures, etc. would be gone.
He said something really nice that day that it was always in my head, that he said that he was gonna the surgery that he was gonna do, it was like he was gonna do it like he was doing it to his wife. Everyone was more nervous than I was. I was super mellow. I was okay, it's Dr. Peterson, I'm gonna be fine.
She came into the hospital. She registered with the nurses and anesthesia. They placed a small IV line in her arm, and then they administer her anesthesia and she falls asleep. During the procedure, I make a small incision in the skin. I don't like to shave any hair. It's totally unnecessary and causes a substantial cosmetic benefit, especially for women if you're able to preserve all of their hair.
Then he told me that he wasn't gonna shave my head, which was a huge relief. Since I'm a girl, I don't want half of my head to be shaved. You can barely see my scar now.
And I make a small window in the bone, about that big. That little window is replaced at the end of the surgery with small little titanium plates about the size of a dime. I use a fancy navigation system that is MRI based that allows me to find the AVM and resect it safely. We also here at the University of Miami have a lot of very fancy neuromonitoring techniques, so we're able to continuously monitor the brain's activity during the entire resection to make sure that we're doing things in a safe way, and if there's any problem, we have a warning sign before we have a serious permanent problem. All of the monitoring signals were wonderful throughout her operation. It was a very straightforward lesion to take out. We resected the little piece of AVM, put the piece of bone back, and closed everything up. She awoke that night, basically just how she was when she went in. She had a little bit of swelling underneath the skin incision, which is normal, and she went home a few days after that.
I feel great. I feel normal. Like I'm still going to rehab. I started like going everywhere in a wheelchair, and now I don't even use my cane anymore. I'm walking like a regular person again. I still have a long way to go, but my recovery has been beautiful. I haven't had any major issues after visiting here. That everything is going to be okay. You just have to find Dr. Peterson and he will help you out.
Brain AVMs are very unusual and complex lesions. Because of this, most centers don't have a lot of experience treating them because they're just not that common. At the University of Miami, our cerebrovascular team manages lesions like this every week. We are a major referral source for all sorts of places, even outside of the US and Central America. Because of that, we have a tremendous experience with this, and our entire team all meets together to discuss every case. Each lesion is different, and it is impossible to say what the best treatment is for each patient. It has to be individualized based on your AVM. Sometimes that best treatment is no treatment. Sometimes it's surgery, sometimes it's radiation, but each one needs to be evaluated by a team of multiple different types of physicians to give you the best treatment. And that's why if you have one of these lesions, call us, we're always here, and we'll figure out a time to have you come in and meet our team, and we'll discuss your case.